If you've ever seen a doctor for joint pain, chances are you've been offered a steroid injection at some point, and you may have some questions about the treatment and other options. Dr. Matthew Kanaan is a Duke-trained physician specializing in non-surgical orthopedics, and he joins us today to talk about some new research and how he's using these studies to help so many patients. Tell us a little bit about your practice.
Yeah, so my practice basically fits in the middle ground between physical therapy and surgery. And so what we're trying to do is kind of think outside the box and come up with treatments that have science-based studies to offer options rather than traditional treatments.
Sure, and I think one of those traditional treatments I mentioned right off the top, steroids.
Yeah.
You go in, it hurts, hey, let's just give you a little bit of an injection. You have some new research to maybe back some of the different studies that are saying there might be some alternatives.
I think we've always kind of known that steroid shots might not be good in the long term. If I was to inject someone very superficially with steroid, they might get a divot where the steroid shrinks the skin and the fat. If we're injecting that deeper, what is that doing long term? I still perform steroid shots, but I'm much more cautious about how many I'm doing, and if I'm doing in the same location, maybe I need to come up with something else. And so, some of us that do this a lot are trying to think of ways that we could treat patients without using as much steroids. Because they can be harmful long term in what we're seeing in the newer studies.
Sure, and you're injecting a substance that's not natural to your body into your body, which I can only imagine probably isn't great over a long term.